The first half hour or so of Tuesday's debate included a lot of healthcare talk and crosstalk. Here's just some of it.
Over the last 4 years, you have promised to repeal and replace Obamacare, but you have never in these 4 years come up with a plan, a comprehensive plan to replace Obamacare.
Of course I have.
Well,
I got rid of the individual mandate.
I'm going to give you an opportunity.
I got rid of the individual mandate, which was a big chunk of
Obamacare.
That is absolutely a big thing. That was the worst part of Obamacare.
Sir,
Chris, that was the worst part of Obamacare.
Let me ask my question.
Well, I'll ask Joe. The individual mandate was the most unpopular aspect of Obamacare. I got rid of it.
What I proposed is that we expand Obamacare and we increase it. We do not wipe any. And one of the big debates we had with 23 of my colleagues trying to win the nomination that I won were saying that Biden wanted to allow people to have private insurance still. They can. They do. They will under my proposal.
It's not what you've said, and it's not what your party has said.
That is simply
your party
a lie.
Doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
Socialist.
Dan Diamond joins me now. He's a healthcare reporter for Politico. Hi there, Dan. Good to see you again. Thanks for joining us. In your Politico Pulse newsletter this morning, you called last night a, quote, hot mess of a healthcare debate. Was there any news made on the healthcare front?
Somewhere between President Trump interrupting Joe Biden and moderator Chris Wallace, there were a few healthcare moments, but I don't think there was much news. My colleague Adam Cankern and I were thinking about what the big takeaways would be for our newsletter, and it felt like a lot of the same, that Joe Biden, like many Democrats, is trying to turn the president's record on the Affordable Care Act and coronavirus against him, while the president has repeated a lot of the same statements and often misstatements or even outright lies about what he's done on healthcare, the Affordable Care Act, and COVID-19.
And Dan, you've also reported on the, quote, highly unusual advertising campaign from HHS. What message is the administration hoping to send with these ads?
We have investigated over the past few weeks in depth this very unusual contract where $300 million has been set aside to, quote, defeat despair about coronavirus in America. And to be honest, there are a lot of reasons for morale to be down. Our response has been lagging. There have been major problems with what the government has done. Things may have gotten better on the Trump administration side, but there is fear among top health officials, including appointees of the president, that the negative feelings in America toward coronavirus could redound to hurt the president as he is moving toward Election Day. This campaign was an effort to try and get 24 different public service advertisements with celebrities on the air before Election Day, making Americans feel more confident about the state of coronavirus and also trying to share some coronavirus information too. It's become a very unusual part of my beat. I don't normally report on celebrities, but the crossover is because the president and his team were very hopeful that there would be a more positive message before Election Day.
Yeah, unusual crossover indeed. Well, you report that a number of celebrities are refusing to participate in the ad campaign now. Actor Dennis Quaid quit the campaign this week, saying that his participation in it was not political. Let's go ahead and watch some of what he said on social media.
Right now, I am feeling some outrage and a lot of disappointment about a PSA, an interview that I did with Dr. Anthony Fauci a few weeks ago. It is being used by the cancel culture media that I was doing a campaign ad, an endorsement of Donald Trump, and that I was paid handsomely for this by diverted CDC funds. Nothing could be further from the truth.
All right. So, Dan, help us understand. Who came up with this campaign? How much did it cost? And who's paying for it?
Well, let's take those in turn. The campaign was the brainchild of an official named Michael Caputo, who is a longtime friend of the president, who until recently was the health department's top spokesperson. Mr. Caputo is now out on medical leave. He said he's been diagnosed with cancer and he's getting treatment. But Michael Caputo had really hoped to set aside these funds to produce a campaign that would defeat despair. He brought in his business associate, a man named Dan Tolmer, to produce these films. They sat down with Dennis Quaid a few weeks ago. And I have some empathy for Mr. Quaid. Our story said nothing about him getting paid, said nothing about this being a political endorsement. And I think celebrities like Dennis Quaid who were approached were only trying to do good. But the question is, what was the Trump administration planning to do with these clips and ads? And you ask, who's paying for it? The answer is the taxpayer. This money was taken from CDC and set aside for this sweeping campaign. And at this point, it's unclear how many celebrities are willing to sign on.
So given that, Dan, what are Democrats saying about this?
They've opened a probe into the origins of the campaign, the firm that is involved with the biggest part of the funding, and they're trying to understand why this is being rushed before Election Day. There are a lot of reasons to have more information about coronavirus and to have people like Tony Fauci or the Surgeon General Jerome Adams talk about the need for Americans to protect themselves against COVID. But this campaign and the way that it has been structured is fundamentally different than the kinds of public health campaigns that the government normally does. And I know that Democrats on the Hill are probing that, and it's certainly been a focus of our investigation at Politico, too.
And Dan, what have you been hearing from people within these agencies, within the department, in the wake of some of these details emerging?
They're stunned and disappointed. This is a lot of money that could go to a lot of different things in the middle of a campaign. If the government wants to inform Americans about coronavirus, there are other ways of doing it than abruptly taking the money from CDC, and in the case of what we found, locking out the CDC and developing this campaign. The CDC and public health experts in the government haven't had a lot of input on this project. Instead, it's been shaped very closely by Michael Caputo, his team, and the filmmaker that he brought in, who, again, is his business partner from before coming into the government.
All right, Dan Diamond, a lot to sort through on your beat. Thank you so much for sharing your reporting with us. Thank you.
Thank you for having me back.